Let us start our discussion on stages of labor and partograph. So first we will start with what are the different stages of labor. So first we'll discuss about the first stage of labor. So the first stage of labor begins with the onset of true labor pain. So first stage, true labor pain, okay. Already in before normal labor video we have discussed what is true labor pain, what is false labor pain. If you remember, true labor pain will be staying for a long time even if you give sedatives, but false labor pain it will stop by itself after giving sedatives. So first stage of labor will start with the true labor pain, okay. And this true labor pain means what? Actually it will lead to cervical dilatation, right? So there is also cervical dilation in the first stage of labor, okay. Next, it will end with full dilation of cervix, like about 10 centimeters. Cervix will dilate up to 10 centimeters in the first stage of labor itself, okay. So further, this first stage of labor is divided into latent phase and active phase. So in the name itself you can see first stage is divided into latent and active. So you can see one is latent, means you can think it's like a lazy phase. One is very active phase, okay. So first, latent phase. Latent phase is the start of true labor pain to 5 centimeters dilation. So we said total dilation in the first stage is 10 centimeters, okay. So in latent phase you have 5 centimeters, till 5 centimeters the cervix will dilate in the latent phase. But in the active phase, from 6 centimeters dilation of cervix. Active phase is from 6 centimeter you can say up till 10 centimeter. This is till 5 centimeter. So what is this all? We are discussing mainly about cervical dilation, okay. So according to WHO or partograph, the latent phase is the true labor pain up till 3 centimeters. So WHO and partograph have their own definition, okay. WHO and partograph, according to them, they are having the definition like latent phase is till 3 centimeters dilation, whereas active phase is till 4 centimeters dilation. So once again let me repeat this. First we are talking about stages of labor. So first stage, in the first step it will start with the true labor pain, true pains, okay. So what are true pains? True pains will lead to cervical dilation. So how much of total cervical dilation in the first stage? About 10 centimeter. In this 10 centimeter they are divided into two parts. One is the latent phase, one is the active phase. Latent phase is up till 5 centimeters. So up till 5 centimeters latent phase, slow lazy phase. Active phase very active, so from 6 centimeters till 10 centimeter you can dilate the cervix. So this is actually in practical case, in clinical case this is true, but according to theoretical case, or you can think according to WHO and partograph, the values are differing. Like in the case of latent phase it is still 3 centimeters, but normally it's 5, right? But here it is only till 3 centimeters. And they are saying active means it is starting from 4 centimeters. Here you know it is starting from 6 centimeters, but here it is 4 centimeters. So this we need to remember. Now let us discuss in detail about the latent phase completely. So latent phase is the two main actions which occur. They are like dilation and effacement of cervix. So what are the two important things which are going in latent phase? One is dilation. You know dilation will go up to 3 centimeters according to WHO, and normally about 5 centimeters, okay. And in latent phase there is also effacement. So what is this word? We will understand effacement, okay. So first we'll see the duration. We'll see the duration in a primigravida. Primigravida means first time this female is pregnant, okay. So everything is new for her, whereas multigravida already she is experienced, she got previous pregnancy, right? So this is a multigravida. So primigravida patient, upper limit of normal is 20 hours, means her latent phase will be like about 20 hours. But in multigravida female, as she already have experience, her her duration will be just for 14 hours latent phase, okay. So average duration you need to take the upper limit. This is the upper limit. Average duration also we need to see, right? So the average duration for primigravida is about 12 hours and for multigravida is about 8 hours. So just we need to remember this. Upper limit means up till 20 hours in primigravida latent phase may be present. In multigravida up till 14 hours the latent phase may be present. But if you see on an average, primigravida it will be up to like 12 hours, multigravida it will be 8 hours. What is this all? This is the time period of latent phase, Okay, so now let us discuss what is effacement. Okay, so effacement of cervix is a shortening or taking up of cervix. Shortening of cervix means, this is the uterus here, this is the internal os here. Okay, and here you will have your cervix like this. Actually what happens is this cervix will move upward due to this dilation process. What happens is, as we discussed before, it is dilating means is its muscle fiber is getting shortened. As it is getting shortened, it will go and indulge, it will go and mix along with the walls here, so it will become a part of the our vaginal system, right? So this is called effacement. Effacement is shortening or taking up of cervix. Okay, so this process is going on in a latent phase. So latent phase is somewhat like a lazy phase. It's like a preparatory phase. It's not an exact active phase that the baby is now going to deliver. Okay, it's just a latent phase. Okay, so now coming to dilation and effacement of cervix occurs mainly due to retraction of uterine muscles. So this dilation effacement, this both will occur mainly because of retraction of uterine muscles. You know about retraction, we discussed just now that because the cervix is, it is dilating, that the muscle fibers are getting short, and that is a retraction of uterine muscles, especially during uterine contractions. Okay, so the lowermost part of uterus is known as isthmus. So this is isthmus here. This is isthmus. Actually this is cervix. That the effacement is nothing but, now you see this cervix is getting completely mixed along with the isthmus, so that process is effacement. Okay, so in a non-pregnant female, isthmus is 0.5 centimeters. Non-pregnant female, isthmus is 0.5 centimeters. Okay, whereas in a pregnant female, the isthmus enlarged like about 5 centimeters at term. So at term, in a pregnant female, you see a very huge differentiation of isthmus size, 0.5 to 5 centimeter. Even the isthmus got dilated and forms the lower uterine segment. So isthmus is nothing but forming the lower uterine segment. Okay, so now let us discuss about, in a pregnant female, the length of the cervix is between 4 to 5 centimeters. Okay, as we discussed, active 4, latent till 3, but normally in a pregnant female, length of cervix is 4 to 5 centimeters. So these are the values which you need to remember. The isthmus is 5 centimeters at term, and the length of the cervix, here you need to write cervix, here you need to write isthmus, right? Or you can also write lower uterine segment. Okay, so cervix length is 4 to 5 centimeters in a pregnant female. Now let us discuss, if the length of the cervix is between 2 to 2.5, that is half of the cervix. So if the length of the cervix is just 2 to 2.5 centimeters, that means half of 4, half of 5 is 2.5. So if the length of the cervix is between 2 to 2.5 centimeters, then you can say it is 50% effacement. So 50% effacement means the size has dropped to 50%. So if no cervix is palpable, then you can say it is 100% effacement. Means effacement means we already discussed, nothing but the cervix is getting mixed with the isthmus. They both are like looking like a single organ, right? They look like a single organ whenever there is 100% effacement. 100% effacement means completely cervix and isthmus got indulge in one other self. Okay, so that is 100% effacement. 50% means the length has dropped to 2 to 2.5 centimeters. Okay, so now coming to at term, the lower uterine segment is just 5 centimeters. So already we discussed isthmus is 5 centimeters, right? So at the time of labor, the cervix become a part of lower uterine segment. Even this we discussed. Okay, so lower uterine segment will be 10 centimeters. Why now the lower uterine segment has become 10 centimeters? Because already the cervix is 5 centimeters and the isthmus is 5 centimeters. So of course if you mix both, cervix plus isthmus will be equal to 10 centimeters, especially at the time of labor. So this is a very important point which you need to understand here. I am saying that the cervix and isthmus are getting indulged in each other, and that process is called effacement. In the starting there will be 50% effacement, that the length of the cervix will drop to 2 to 2.5. Actually normal length of cervix is between 4 to 5 centimeters. Okay, that is the first process. In the second process there is 100% effacement. In this process what happening, the lower uterine segment, that is the isthmus, is completely mixing with the cervix. So normally the normal value of isthmus is 5 centimeters, and the cervix normal value is 5 centimeters. So if you mix both together you'll get 10 centimeters. So 10 centimeters is the value at the time of labor because of this effacement, 100% effacement. So if you remember, in primigravida we have discussed this time hours, right? One more thing you need to remember regarding primigravida is the first effacement occurs, later dilation occurs here. Okay, so first process here is effacement, second process is dilation. Okay, so first this cervix and isthmus will mix, and next it will lead to dilation. Whereas coming to multigravida, in multigravida already the effacement is completed, so dilation and effacement will occur simultaneously, and the progress is very quick. So in multigravida, effacement and dilation at the same time, simultaneous. Okay, so it is very quick. It is somewhat slow in primigravida. Now coming to, due to retraction of uterine muscles, the upper uterine segment becomes very much thicker at the time of labor. And you understood, I think. Due to retraction of uterine muscle fibers, upper uterine segment becomes thicker at the time of labor, and the lower uterine segment becomes thinner. So you can see here, this is the upper uterine segment. For example, this is the lower uterine segment. Even though the cervix and isthmus both together form 10 centimeters, but the upper uterine segment become more thicker because of retraction of uterus, especially at the time of labor. Okay, and some extent is due to even polarity. So the lower uterine segment is the non-contractile part of the uterus, whereas the upper uterine segment actively contracts and relaxes to push the baby, whereas lower uterine segment passively dilates. So the main contracting part is upper uterine segment contracts. Okay, lower uterine segment is non-contractile. This is very important point. Okay, so just it's like a passive dilator. It is a passive dilator. So upper uterine segment will be contracting the head of the fetus, and the lower uterine segment will be receiving it. Okay, so now let us discuss about the active phase of labor. I hope you have understood the latent phase very clearly. Okay, so now let us discuss the active phase of labor. Coming to the active phase, as per ACOG or as per clinical guidelines, if you see, from 6 centimeters of cervix, right? We already discussed here active one. According to clinical, if you see, it will start from 6 centimeters, or it can either go till 10 centimeters in total, right? So it is starting from 6 centimeters, but as per WHO and as per partograph, if you see, it is just 4 centimeters, from 4 centimeters dilation. So cervical dilation is more rapid in active phase. That's why the name is active, right? So the minimum rate of cervical dilation is 1 centimeter per 1 hour. This is very important. So active, in the name itself, it's saying for every 1 hour, 1 centimeter of the cervix should dilate if it is in an active phase. Okay. So primigravida have 1.2 centimeter per hour. So primigravida, for them the cervix dilation will be 1.2 centimeter per hour, and in the case of multigravida it will be 1.5 centimeter per hour, because already multigravida have experience, so her uterus will be already ready, so it will contract somewhat more, 0.3% more when compared with the primigravida. But on an average we just will remember that the uterus, the cervix will contract 1 centimeter per 1 hour. That is enough. No need to remember that much particular value clinically, but theoretically you need to remember this. Okay, primigravida 1.2 per hour, multigravida 1.5 per hour. Now coming to descent of fetal head also occurs in active phase, of course, because latent is just like a resting phase. Okay, so in active phase everything will occur. So in the primigravida the head will be moving like for 1 centimeter per hour, in multigravida 2 centimeters. So the delivery process will be very fast in multigravida, because the head movement will be 2 centimeter per hour, here 1 centimeter per hour. Okay, so now coming to, this is what about head descent. Okay, So now coming to the descent of fetal head also occurs in active phase, okay, that we discussed just now. Now coming to crowning. Crowning is not included in first stage of labor as it occurs after full dilation of cervix. So actually whatever we discussed just now, this is the first stage of labor, right? First stage. So in the first stage itself you will not get crowning. Crowning is nothing but the head which is starting to come out from the lower uterine cavity, right? So head will not start coming in the first stage itself, because there are still second and third stage, we should give chance to them, right? So second and third stage where you will see actually the actual procedure of labor here. So this is just a starting phase. In that starting phase also we have discussed the latent phase, somewhat a preparatory phase, and we have discussed the active phase, which is a real active process, okay? So now let us start with second and third stage of labor, okay? So second stage and third stage. So coming to them, it begins at full dilation of cervix and ends with delivery of fetus. So full dilation, you will see the full dilation of cervix here till this period to completely delivery of fetus. So here at this second and third, you can see there is a delivery process. So duration varies depend upon the administration of epidural anesthesia. So because why duration varies, because epidural anesthesia, it will increase every stage by 1 hour, because epidural anesthesia prolong every stage by 1 hour. So that's why the duration varies according to epidural anesthesia if you want to do painless delivery. But if it's a normal delivery, then this prolongation of 1 hour will be not there, okay? So now coming to normal upper limit of primigravida. For this second stage and third stage, the normal upper limit will be 3 hours and the average will be 1 hour. Coming to multigravida, the upper limit will be 2 hours and the average will be 30 minutes. So just within 30 minutes in the second stage of labor or third stage, directly there will be delivery. So in case of epidural anesthesia, just add 1 hour to the upper normal limit. So for example, in the case of primigravida, expected time will be 4 hours. In the case of multigravida, 3 hours. Like this, just add 1 hour to it. So coming to third stage of labor. So just now whatever I have discussed is all about the second stage. So in second stage, there is full dilatation of cervix. Like if you give epidural anesthesia, every stage will be prolonged by 1 hour. Now coming to third stage of labor. Third stage of labor begins with the delivery of the baby and end with the delivery of placenta. So finally delivery has occurred in the third stage of labor. So upper limit of the normal is 30 minutes. So upper limit is 30 minutes for the third stage, and the average duration is 15 minutes. So further decrease in active management of third stage of labor. So no need to do any active management, just it's ready to come out. So coming to the fourth stage of labor. In the fourth stage, 1 hour observation period after the delivery of placenta. What is fourth stage actually? It is a 1 hour observation period. Observation. You need to observe the baby right after the delivery. So 1 hour observation period after delivery of placenta, the patient will experience some physiological chills. So you will see it is physiological, no need to worry, it is a physiological chills. And the usual time for rupture of bag of membranes is at the end of first stage of labor. So remember, at the end of first stage of labor only, the membranes also will rupture. In the fourth stage, you will see there are some physiological chills, and it is nothing but the observation period. Already delivery has occurred, it is just an observation period, okay? So this thing you note at the end of first stage of labor only, there is a rupture of bag of membranes. Okay, so by this we have completed the part 1, the stages of labor. In part 2 we will mainly discuss about partogram or partograph.